On today's Doctor Is In, are you too embarrassed to talk to your doctor as honestly as you should? You can't be afraid to tell them your symptoms. A hush-hush attitude may be risky. Dr. Scott Ackerman, one of the First Coast leading doctors, is here to tell us why. You need to get past your discomfort and tell your doctor everything. Thanks so much for being here.
Thank you, Casey.
And you have some reasons that you've broken down as to why it is not a good idea to hide things from your doctor. And let's start out with the first thing that you should always tell them.
Right. Don't hide them or lie.
Okay. Yeah, it doesn't do you any good. What good does it do? You're only hurting yourself.
So make sure a few things. There are things that people forget to tell their doctor. They're not really hiding or lying, but they just don't think that it's important necessarily. So let me tell you one thing that's very important. When you see your physician, make sure that he or she knows about what vitamins or herbs or supplements that you're taking, because many of those can interfere with other medications. They can interfere with absorption of medication. They can interfere with metabolism of different medications. Let me use some examples. Calcium, if you're taking calcium supplements, no one thinks, oh yeah, I'm taking calcium.
Yeah, it's just one of those things you do.
Right, but it can interfere with antibiotic absorption. So if you have an infection and your doctor gives you an antibiotic and you don't get better, maybe it's because you're taking calcium and you're not absorbing the antibiotic at the strength you need to. Another drug, the herb ginkgo. Ginkgo
biloba.
Thank you.
Yes, you forgot.
I used to know that drug.
Right, exactly.
Ginkgo biloba, which is good for memory, can cause heart palpitations, and also
really,
and it can also interfere with blood pressure medications. So you don't want to have your blood pressure go too low because you're taking ginkgo biloba, or you want your blood pressure too high if it interferes with those medications.
Okay, what's another thing that you should always tell your doctor?
So if you were given a prescription by your physician and you stop taking it or you alter the dosage, be sure to tell your physician about it. It's very dangerous when patients self-alter the treatment. It can be dangerous. Sometimes it's not, but it can be dangerous if patients self-alter the treatment plan or stop taking the medication altogether. The physician may think the treatment is not working, and then increase the dose or change the method when it's just the fact that
you're not doing what you were told you should be doing.
Right, or if you're having certain side effects from the medication, these could be concerns that the physician would have, and these side effects may have the physician change your treatment. So instead of just not taking the medication because it's making you nauseated or whatever, tell your physician, and he or she will change the medication so you get treated properly and you'll have no side effects.
Okay, so what's the third thing on your list that is a must tell your doctor?
So when you see the physician and they ask you, do you have any medical problems before, any surgery, don't forget anything. The things you had even as a child are important. So make sure you give a full medical history when you see your physician. Childhood surgeries.
Even like tonsils? I was just going to say the same thing because I was thinking, I don't even know my history.
Well, if you had an appendectomy as a child, there could be problems later on in life associated with that appendectomy that the physician would want to know about. If you're having abdominal problems as an adult, it could be related to some scarring associated with that appendectomy, those sort of things. Also, family history, any major illnesses in your immediate family, or any previous illnesses that you have had. Both these things can help the physician understand what symptoms you're having and help to diagnose what you might be having now. As I said, past surgeries, current conditions, these again help the physician diagnose the symptoms that you're having now and shape and decide what is going on with you. And also, these past surgeries and family history will help shape screening guidelines for you. So if you had a mother or an aunt with breast cancer, your physician's going to want to make sure that you get screened appropriately for breast cancer yourself and maybe start the screening process a little bit earlier. Same thing for men with a family history of prostate cancer or those sort of things.
And it's good, because I was going to say, I'm just thinking about when you're talking, all the things that, if I've had, I don't really remember because I never write it down. If you're in the military, they provide it with, to you, a whole medical record. But so maybe it's good just to like leave one sheet or something to have just to hand to the doctor. Is that a good thing?
A lot of my patients keep it on their computer.
Okay, like a little diary?
Yeah, they keep their medical history on the computer, the medications, the surgeries, so they do it at one time. And then as life goes on, they add things to it as needed. And so when they come, so I see people after they're diagnosed with cancer, so maybe they've been doing this for years, and now they're diagnosed with cancer, they hit the print button, they print it out, and they bring it to me. Has all their medications, all their history, it's all right there. It's really, really simple.
Oh yeah, that's really smart. And last but not least, you say, don't be embarrassed by your habits.
Yes, so don't forget to talk about your bad habits. Smoking, poor diet, no exercise, those sort of things. Be honest. about that with your physician, because that helps your physician diagnose diseases early, because the physician knows what to look for. For instance, heart attack or diabetes, those sort of things. The goal with the interaction with your physician is to keep you healthy. The more information we know as physicians, the better job that we could do in diagnosing, in screening, and treatment.
It doesn't help to hide anything, because it doesn't help you. The ultimate goal is making you feel better, and if you're hiding stuff, then obviously it doesn't work. Thank you so much, as always, Dr. Ackerman, for being here. We appreciate you coming on every Friday. And for any questions regarding today's topic or any other health questions that you might have, you can connect with Dr. Ackerman on Facebook by visiting facebook.com/First Coast Oncology.